when we get a vaccination, we are not immediately immune. The vaccine takes weeks to allow our bodies to build up the appropriate level of antibodies so that we can fight off the infection. The 95 or 94% number that you've been hearing when people talk about the effectiveness of these vaccines takes 6 weeks to accomplish, 6 weeks and 2 doses. So the way they achieve that effectiveness is they give you the first shot of vaccine. About 2 weeks after that first shot, you are reaching 54% effectiveness in preventing symptoms of severe COVID. Then you get either 3 weeks later if it's Pfizer or 4 weeks later if it's Moderna, you get the second shot. About 2 weeks after the second shot, that's when you hit 95% effectiveness and not before. So that whole 6-week period, the person who's vaccinated is still at risk, not just of getting the infection, but of developing severe symptoms of COVID-19.
You mentioned that 2 weeks after the second dose, we are much less likely to develop symptoms of
That's
severe
right.
COVID-19. But
Mhm.
one thing that I heard in there was that that doesn't necessarily prevent us from transmitting the disease. So we can still carry it, right?
We don't yet know if this vaccine helps prevent us from becoming infected with coronavirus in a way that then could lead to us transmitting the virus to others, even though we ourselves, as the people who are vaccinated, are not developing symptoms of COVID. So in other words, we could still have asymptomatic transmission of the virus. The benefit of the virus, while we are waiting to see if the vaccine prevents transmission of infection, which it may eventually do, while we're waiting to discover that, we do know that we, as the vaccinated people, will have less severe symptoms and will be less likely to have severe COVID. And just being asymptomatic reduces our risk of having, for example, a cough that creates droplets and aerosols that can then reach out and infect other people.